Hello, my name is Dr Jo Crofts and I'm a labour ward consultant here at Southmead Hospital, and this is Fiona Scriven, one of our midwives, and we'd like to provide you with some information about COVID-19 and pregnancy and your care here at North Bristol NHS Trust. We are aware that the current situation surrounding coronavirus or COVID-19 is extremely worrying for pregnant women and new parents. Firstly, we want to reassure you that your care is our priority alongside the safety of our staff. All the measures that we're putting in place here at North Bristol NHS Trust are an attempt to reduce the spread of COVID-19 infection whilst maintaining a safe maternity service. However, national guidance are constantly changing as we get new information, so please make sure when you're watching this video that it's the most up-to-date information that we have released.
The most obvious thing that you will notice is that all staff members who have close contact with women will be wearing face masks, aprons and gloves during any direct care. This is to protect you, your baby and your family, as well as our staff, by reducing the spread of infection. Where appropriate, we will be conducting antenatal and postnatal care by telephone, but of course if further care or tests are needed, our community and hospital teams will still see you in person.
In line with the government's strict rules to help reduce the spread of coronavirus infection, North Bristol NHS Trust has suspended visiting to all our adult wards. However, we're pleased to say that an exception has been made for the maternity unit. When you're in labour, you will be able to have one birth partner with you. However, if your planned birth partner is unwell, they will not be allowed into the maternity units, so we suggest you consider now who you'd want to be with you if this situation occurs. If you do need to stay in hospital, either before or after your baby is born, then we are sorry to say that visiting restrictions still apply and birth partners will not be able to come to the wards.
It is really important that you continue to get antenatal and postnatal care, and where appropriate we will do this by telephone, but if further care or tests are needed, we will still see you in person. A midwife will inform you of any changes to the arrangements needed for your care, so please make sure we have your correct contact details. If you're unsure whether the details we have are right or not, please contact your community midwife using the numbers on the front of your handheld notes. If you have an appointment and are symptomatic of COVID-19, please let us know so that it can be rearranged for when you are symptom-free and out of the isolation period. For scan appointments or those at our hospital antenatal clinic, please call 0117 414 6923. For appointments with your community midwife, please contacting them using the number on the front of your notes. North Bristol Trust are no longer running antenatal classes, but your community midwife will be able to direct you to online alternatives. In line with national recommendations, we ask that you do not bring anyone with you to any of your appointments at the hospital or in the community.
If you are experiencing any concerns related to your pregnancy, such as reduced fetal movements or bleeding, then please call our assessment unit as you would normally do on 0117 414 6906. Midwives on the telephone will ask you whether or not you or anyone in your household has any symptoms of the coronavirus, such as a raised temperature, a dry persistent cough or shortness of breath. This will not stop us seeing you if you need maternity care, but we do need to know in advance so that we can put precautions in place when you arrive to protect other women and our staff. For labour care, Cosham, Mendip Birth Centre and the Central Delivery Suite are currently all still open and staffed. We are here ready to look after you throughout your birth. Please phone your chosen place of birth directly if you think that your labour is starting using the numbers on the front of your handheld notes. Unfortunately, we've had to stop providing our home birth service for the safety of women, but we would encourage all of our low-risk mothers to attend one of our birth centres for labour care. For women who are symptomatic of coronavirus, the guidance is for you to be looked after on the Central Delivery Suite when you're in established labour, as you and your baby will require additional monitoring and care.
If you have had your baby recently, you may find the number of visits that you have at home will be decreased compared to normal. We aim to conduct many of these appointments by telephone, but we will still come and see you if needed. This is to make sure we're maintaining a safe service for all of our women, as well as ensuring the safety of our staff. The Registrar's Office is currently not issuing birth certificates due to the coronavirus pandemic. However, you will still be able to claim child benefit or universal credit. You can visit the gov.uk website for more information. As the situation develops, please follow us on social media, which will be updated with any changes in our guidance or services. You will also find up-to-date information on our website, the NHS website and our app. The app is free and is called My Pregnancy at NBT. You can find it by searching in the App Store or the Play Store. This also has lots of other information about all aspects of pregnancy and the first few weeks of your baby's life.
Thank you for taking the time to watch this video. The information and guidance regarding COVID-19 infection is constantly changing, so please keep checking for updates. Regular updates are provided by the Royal College of Obstetricians and Gynecologists, the Royal College of Midwives, the Royal College of Paediatrics and Child Health, and Public Health England. These can all be searched for online. In the meantime, please stay safe, keep washing your hands, and we look forward to welcoming you here at North Bristol NHS Trust for the care of you during your pregnancy and the birth of your baby.